Hello and welcome to Lil-Lets Talk Online, the podcast where we talk all things periods. I'm Megan Ross.
And I'm Bokang Lehlokoe.
And we are your hosts. If this is the first time that you're hearing about Lil-Lets Talk, you'd be very happy to know that it's a free online platform where you can have all your questions related to menstrual health answered by peer and expert responders, such as ourselves.
Such as you, Meg, and myself. Meg is a head moderator on there. I'm one of the responders. And I think the nice thing about Lil-Lets Talk, the platform, we have so many conversations there. But now we're taking it to the next level, guys. We're having a podcast and we're going to be joined by a whole lot of special guests. But today, we do have someone in studio joining us for today's topic. But, just in thinking of which topic we're going to discuss, because like I said, there's just so many on the platform. One that really stood out and we had so many questions about was infertility, right?
That's right.
It is infertility. Not fertility. Okay,
yes.
Infertility.
And it comes up again and again on the platform, whether it's worries about irregular periods affecting infertility or, whether it's something like amenorrhea affecting infertility. This really does come up again and again. And lucky for us,
we got an expert in the house.
That's right.
So we have Fatima Kathrada joining us. Fatima, please just introduce yourself for those of us who don't know or may not be familiar with what you do.
Thank you so much for having me. So I am a Lil-Lets responder, as you all know. And I am a pharmacist and an academic and researcher within the space of women's health and women's reproductive health.
So we were having a chat earlier on and you were saying that you're also an endo warrior and that was how your introduction into the infertility space came about.
That's correct, yes. So I am an endometriosis patient with stage 4 endometriosis and I've battled with infertility for over 10 years. And that is what has actually birthed my passion and why I've delved into the area of reproductive health within my research and on a personal capacity in terms of providing education initiatives for females affected with infertility.
Wow. You're doing a lot. You're doing the most. And you're actually the perfect person to answer all these questions that we have on the platform. Mm-hmm. So I don't know, guys, if you're ready to get into it, I'm down to know the answers to some of these myself. Cool. So the first one is it possible to get pregnant while suffering from amenorrhea?
Okay.
Now,
yes.
I'm not going to lie. I didn't know what the word amenorrhea even meant until a couple of days ago. So could you please just
from the basics?
Please just explain.
Yes. So amenorrhea is basically the absence of a period or a menstrual cycle. So it could mean anything from whether a female would actually have a period and thereafter stop having a period, okay? Or if a female just never ever had a period. And so that's what we term as amenorrhea, so the absence of a period. So as long as you don't have a period for over 3 months, it can be recognized or classified as amenorrhea.
So 3 months, that's the window, that's
Yes.
essentially when it's classified?
Yes.
Okay.
And is it possible to get pregnant while dealing with amenorrhea?
So it's a very tricky question and a very common question that we have found on the Lil-Lets Talk platform. And what's very important to note is that the answer is not that no, you cannot fall pregnant. However, it might be more difficult for you to fall pregnant. And the reason for that is that there's so many different reasons for amenorrhea. And we need to dig deep into the root and the cause of amenorrhea to then say, how can we treat the underlying cause? And thereafter, you can look into your different options in terms of fertility treatments or reproductive, assisted reproductive technologies. So in terms of the amenorrhea, there are many causes. You can look at a simple thing like stress that causes hormonal imbalance. Excessive exercise can cause amenorrhea, it can cause irregular periods. Different conditions that you might have. So conditions like PCOS, conditions like thyroid imbalances, and many medications that a woman can be taking can actually cause amenorrhea. So it very much involves looking deeper into the underlying cause.
I'm just having a look, and does having irregular periods affect fertility has also come up. Would that fall into the same space, do you think?
Yeah, because amenorrhea is the absence completely, but what if you just have your period?
Exactly, yeah. And irregular periods is very common, particularly when a woman just starts menstruating. In most menstruators who start menstruating, they'd see an irregular period. So that's not abnormal. And once again, no, it's not that you cannot fall pregnant, but it might be a bit more difficult to fall pregnant.
Okay.
And again, thereafter, we need to look at the underlying cause, treating the underlying cause. And one of the major causes of irregular periods is a condition like PCOS, which is so prevalent amongst our menstruators.
I actually have PCOS, and so I've answered quite a few questions, not so much obviously from a medical point of view, because that's not, I don't have that knowledge, but definitely from a point of sympathizing and empathizing with other people who have it.
Yeah.
So when it comes to looking at the underlying causes, what do we actually mean by that? Is that going for a scan with a gynecologist or?
Yes.
Okay.
So very much starting, you do not even have to seek specialist attention immediately. Mm-hmm. So you can go to your local clinic, you can go to a local GP, and that's where you start the process. Because sometimes it may be looking at just your medical history. You might be taking medication that may be influencing your menstrual cycle. So something as simple as that. So a thorough history and physical exam, don't leave it to be. Don't sit there and say, okay, I have an irregular period, I'm not going to be able to fall pregnant, this is what I have. No. We need to look at the root causes. So go out there and get the attention, the medical attention that you need, so that you can look at what is the causes and treat them accordingly.
At the end of the day, it's like just empowering yourself to take care of your own health.
Exactly.
Yeah.
And that is what this platform is for, to make sure that you are informed and you know when to seek medical attention.
Here is the question. During my fertility window, I experienced a heavy yellow discharge. It only happens during the fertility window. Then afterwards, my discharge becomes normal. What could be the cause? And what is a fertility window and how do you calculate it? I think let's start there because I would like to know.
Okay. Yeah. Definitions, definitely. So your fertility window is basically the period in which you are most likely to fall pregnant. And we term that as usually the 3 days or 5 days prior to ovulation, including the day of ovulation. And so why this is important, you'll see that many patients are advised to time sexual intercourse. And so timing sexual intercourse means that you time it such that you make sure that you have sexual intercourse during those days, your fertility window, to increase the chances of falling pregnant.
But hang on a sec. How on earth do I know when I'm fertile? How does one calculate that?
So very good question.
Yeah.
You can actually calculate that yourself just by looking at your menstrual cycle.
Okay.
So the average menstrual cycle is around 28 days. And so the average date that a woman would ovulate would be 14 days prior to your next period. So an easy way that I usually advise patients on how to calculate this, and especially because most patients don't actually have a regular period. And women need to know that that's normal. Okay, so how do you calculate your cycle? So we usually advise that you do it over 3 months. Every month, you write down the length of your cycle, which you count from day 1 of your period to day 1 of your next period.
Okay.
You write down the number. You do that for 3 months. You add it up and divide it by 3. That gives you your average cycle. And then when you want to calculate when you're ovulating, it would be 14 days before your next period.
Okay. And I mean, this information is so important because I find it quite ironic that, a lot of women, we spend so much of our fertile lives trying to avoid pregnancy. And then it might come up that, we actually do want to fall pregnant.
And then what?
And then what? Yeah.
Yes. And then getting back to the question as well. So there are ways that your body signals and that you can identify, oh, wait, am I actually ovulating or not? And your question asked whether or not having a discharge,
a yellow discharge,
is normal or not. So generally, yes, when you are ovulating, a woman would have a very wet discharge. In most cases, it's clear to white in color. So for this question, I would actually advise this patient to actually note down, it would be normal if it's not associated with any painful symptoms, if there's no odor associated with the discharge, if there's no vaginal itching, if there's no burning or urination, then it would be perfectly normal. If it does have any of those associated symptoms, then she should have it checked out. And other types of signals to alert you that you actually are ovulating is that during that time, apart from the discharge that you would experience, you may have some breast tenderness.
Okay.
You may have some bloating. You may have
Know that one.
Very well, unfortunately.
and you may have even an increased sexual drive during that time. And your basal body temperature would increase slightly. So some may say a good indicator is to actually test your basal body temperature, and it might increase by 0.5 to 1.
Oh, wow.
This is also, it's so complex, you know? And it just makes you realize that, wow, I actually don't know that much about my body, or there's just so much more to learn, you know?
Exactly.
Which again makes a platform like this, I mean, without Lil-Let's Talk, I wouldn't know half of the things that is actually happening
And you
every
are
day.
experiencing it.
Exactly.
Correct.
And the
Yes.
mathematics involved in all of this.
Yes.
Sure.
Okay, Meg, do you want to go on to the next one, which is a,
Let me
hot
grab this
topic, bit of a controversial one.
So, contraception. I have been using Depo for 12 years. Now we are planning to get pregnant. So how long will it take for it to wear off out of my system? My last injection was in February this year, and I'm 35 years old.
Okay, so very good question. You know, like Megan just said earlier on, that we try so hard not to fall pregnant, and we know everything about not falling pregnant, but then when we want to fall pregnant, we don't know where to look. And so there's no hard and fast rule, and I always tell patients not to panic. There's always a range. It's not definite that if you're taking a specific type of contraceptive, you will see your next period or your fertility will return within a specified period. It may vary from individual to individual. So with regards to the Depo, so for those that don't know, it's an injectable type of contraceptive. It usually, ideally, within 3 months, your fertility should start returning. But in most patients, the average return takes between 8 to 10 months.
Okay, that's quite long.
Yeah. So patients shouldn't actually worry. Know that it can take a bit of a while, so give yourself that time. And by 8 to 10 months, your fertility should return.
Does age actually have a factor in it? Because she did mention that she's 35 years old, and you know, we always hear this thing of like a biological clock. So when it comes to like
TikTok.
fertility, or even like just the effects of birth control on your body, does age potentially, could
Age
it have
does
an
play a
effect?
role,
Okay.
particularly with regards to the quality of your egg production.
Okay.
And it does start to decline after the age of 35.
Sure.
So we do say that those that are trying to fall pregnant, if you're over the age of 35 and you've been trying for 6 months and you haven't fall pregnant, then you need to consult with a medical professional. However, for those that are under the age of 35, you should try for at least 12 months before you see a medical professional.
Okay,
But
so-
it's not a hard and fast rule. If you feel something is not right, go and see a medical professional.
All right, but it's safe to say that 12-month window, essentially.
Yes,
Okay,
yes.
and then anything after that, you need to really
Yeah,
go see someone.
that's correct. Yeah.
Okay.
So yeah, we're speaking very much on, you know, Depo-Provera and the injection type of
Yes.
contraceptive. But I'm just curious to know about, like, you know, the effects of others, you know, like whether it's the pill or the IUD. Is there maybe a preferred, or is it kind of like with each individual, you know, you're just going to experience, it's not a one-size-fits-all kind of situation?
Yeah, no, definitely. You know, and those type of questions are very important before you start a contraceptive. So when you ask for which is the best suited for you, it's very much takes into account what you can manage and very much when you plan to fall pregnant. And so, for example, the combined oral contraceptive, okay, which many would refer to as the pill. So if you're on a normal, regular dose or low dose combined oral contraceptive pill, within 3 months, your fertility should return. With the injectables, like we said, it's a longer period, okay? If there is the implant as well, once the implant is removed, within 14 days to a month, your fertility should return.
Oh, that's quick.
Yes,
Wow.
and so with the IUD, like you mentioned, so for example, the copper IUD, that is usually the intrauterine device that is inserted. Once the IUD is removed, your fertility returns almost immediately.
Wow.
Oh.
Okay, but remember, these are also based on the average return of fertility, and in some cases, it may take you longer for your fertility to return.
So, I mean, just judging by this conversation, it really seems like fertility is a lifelong journey that we're on. You know, when we're choosing contraceptive, we're actually, without even knowing it, planning our futures already.
Correct. And that's why it is so important to really not just look at what's the easiest option, but to take into account your future and to take into account where you see yourself and when you would like to fall pregnant.
Okay.
Yeah.
Wow.
All right, wow. Oh my gosh, Fatima, this has been such an enlightening conversation. Unfortunately, it's come to an end.
It's been
but
amazing.
I mean, thank you so much for being here. And if people want to just find out more about you, what you do, where can they find you?
Okay, so my initiative is Women's Health by Fatima Kathrada, at Fatima Kathrada, or at Women's Health by Fatima Kathrada, just based around providing evidence-based medical information around all women's health and reproductive health topics. And obviously ask us your questions on the Let's Talk, and we are happy to answer them.
So, B, I'll see you on a Let's Talk then.
As always, I'll be there. And yeah.
This has been amazing. It's been so great chatting with you and with you, Fatima. And I'm just thinking, like, we're in such a stunning space.
Listen,
Yeah.
it's the uterus is giving me life. The couch premiere has really gone above and beyond for
Totally.
us. So I'm excited for more episodes, guys. We're gonna have like a lot more guests. So make sure once you go to the Let's Talk platform, you just throw in some questions there. Who knows? We could be answering them.
Yep, next episode.
Okay, see you. Bye.